We're going to bring you more now on the news that Public Health England is to be axed and replaced with a new agency that will specifically deal with protecting the UK from pandemics. The Health Secretary, Matt Hancock, says the new body is the National Institute for Health Protection, will report directly to ministers. To what extent, however, has Public Health England become a scapegoat, perhaps, for failures in the government's response to COVID-19? Let's turn to Christina Marriott, Chief Executive of the Royal Society for Public Health, who joins us now. Christina Marriott, welcome to you. Could we just explain to viewers, perhaps, who've grown familiar with the acronym PHE over recent months in COVID, but before then, since it was founded in 2012, I think I'm right in saying, how would people have encountered it in their everyday life?
So it was set up, as you say, in 2012, started operations in 2013. The sort of places you will have seen it will have been for things like smoking cessation services or campaigns around physical activity or diet and obesity. They do lots of work on sexual health. And they do lots of work about outbreaks. So you may have seen the work that they did in Salisbury with the poisoning. They've handled 10,000 outbreaks over the past few years ahead of COVID. So they do a response to health protection. So they respond to pandemics, they respond to chemical leaks, they respond to that protection aspect. But they also work with the public on their health promotion and improvement of health, particularly around things like health inequalities. So trying to make all of our communities as healthy as they can be. And that was really important as we went into COVID, because one of the things we know is that not every community was equally healthy. And that's been one of the reasons why COVID's hit England particularly badly.
Systemically, was that too big a tent to cram so many really quite different forms of preventative medicine into, and sometimes even contradictory ones, when you think back to, the contradictions there appear to have been over, say, combating obesity and recent measures to, encourage people to go and buy in restaurants, for instance?
I do. So I think that contradiction sits squarely with the government, who managed to launch Eat Out to Help Out and the obesity strategy within 10 days of each other. You are right, though. Public Health England has a very wide remit. And, of course, it works with local directors of public health based in every local authority. And that's a really important network to work with. They do have a wide remit. And I think there is split health protection back off away from health promotion. That was the situation before the Lansley reforms of the Health and Social Care Act of 2012, when we had the Health Protection Agency. What I think is important is they're retaining what they have in Public Health England, which is direct accountability to the minister. So the minister stays accountable for health protection and health promotion, as he was for Public Health England. They reported directly to the minister. We would query, however, doing this in the middle of a pandemic, so causing this much distraction, this much disruption, and demotivating a workforce who we are going to be dependent on if there is another wave of the pandemic, doing it to them right now when they've all worked hundreds of hours of overtime in the past few weeks and months, feels to us a very wrong timing. And it feels to us a very wrong timing in particular because we are still awaiting the Prime Minister's promised inquiry into what went wrong with England's response to the COVID. We have had internationally appalling mortality rates. We have the highest death rate in Western Europe, and that isn't the failing of one organisation. That is failings across our pandemic response. And unless we learn those lessons of which organisations made which mistakes, what were the wrong decisions, we can't respond better and protect the public's health better in any future waves.
Yeah, it's impossible to predict, however, at this stage, as and when second or successive waves will hit. And therefore, you could delay this reform until next year, but you may find yourself in the teeth of another pandemic.
And probably much more likely it will be this autumn and into this winter. So we do think there is likely to be further waves of this pandemic. And we know that these sort of large-scale disruptions of public health systems take 3 to 5 years to bed in, and they are very expensive. More useful would be the government thinking about its spending review in a couple of weeks' time, and given the whole of public health a substantial and medium-term settlement so they would know what budgets they've had. Public health has worked under austerity. It has had an £80 million real-term cut since 2015-16. It has a budget that is 22% down on where it was just 4 years ago. What's more important is we put sufficient money into the system rather than we throw it back up and see how it lands. It's the wrong time to do this. In the middle of a pandemic, when the next wave may be just weeks away, it is very distinctly the wrong time to do this. We also need to know what's going to happen to those wider aspects of health promotion, what's going to happen to all the work on health inequalities and on health promotion. Those areas of work around alcohol, obesity, physical activity and smoking account for 40% of premature deaths every single year, and they account for a huge number of the excess deaths under COVID. We need to continue the work on that. And what Matt Hancock said today, what the Secretary of State laid out, gives us no details about what's going to happen to that work, which leaves the workforce in confusion, it leaves the public health system in confusion, and now's not the right time for confusion.
Christina Marriott is Chief Executive of the Royal Society for Public Health. Thanks very much for your time. Thanks a lot.